Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So today we will have another important topic of comorbidity, that is cerebral palsy. Cerebral palsy is one of the very important topic of pediatrics or comorbidity. So today we will have the discussion of cerebral palsy. Now, if you look at cerebral palsy history, there is a documentation that cerebral palsy is present. The word cerebral palsy is also present in 14th or 15th century also. Okay? The oldest evidence which is present to say that this is cerebral palsy is mummy of Sitpat of Egypt in 1996 to 1990. Similarly, the word meaning of palsy, the word is actually a Greek word which means weakness. It is also mentioned in the school of Hippocrates, that is in 460 to 370 BC. English surgeon William John Little in 1810 to 1894 is the first one who conducted the study on cerebral palsy extensively. Hence, the cerebral palsy is previously and even now it is also called as Little's disease, because the English surgeon William John Little is the first man who extensively studied cerebral palsy. In 1880, Williams Govers also worked on the same topic. In 1849 to 1919, William Osler also worked on this. Okay, in 1997, first time the gross motor function scale was introduced, so GMFCS was introduced. So these are some of the landmarks in the development of a study or the development of the cerebral palsy as far as history is concerned. Now let us see what do you mean by CP, cerebral palsy. There are many definitions related to CP. Brain disease causing paralysis. This is one simple definition. Is a brain disease which is causing paralysis. Another is a disease causing damage to the brain. This is also mentioned. And another important definition is this is a non-progressive degenerative disease of the brain. Very important. This is non-progressive degenerative disease of the brain. Another is this is a movement disorder of the brain. This is also mentioned. This is one of the movement disorder of the, because movement is get affected, spasticity and all, movement is get affected. And another definition says it's a neurodevelopmental disease. So now we need to combine all these definitions to have an extensive, complete definition. Now, cerebral palsy, cerebral means brain, we know that, and palsy means the problems with the body movement, maybe in the muscles. So this refers to group of disorders that affects the muscle movements and the coordination. In many cases, vision, hearing, sensation loss will be also seen. So this is one of the most common cause of motor disabilities of the childhood. Basically, this is a motor problem. Therefore, it is also called as movement disorder. Okay. So most common cause of motor disabilities of the adulthood, rather childhood. Now, according to CDC, there's a Center for Disease Control and Prevention. About 1.5 to 4 out of every 1,000 deliveries will develop cerebral palsy. This is a very significant data. About 1.5 to 4 children of every 1,000 deliveries out of 1,004 will develop cerebral palsy because of many causes. So this is a group of permanent movement disorder. This is also called as this is a group of permanent movement disorders that appears in the childhood. The abnormal development or damage to the parts of the brain that control the motor function, movement and posture. That means there is actually damage to that area of the brain which is going to control the motor function, movement and posture. When that is affected, so child will have most of the time the muscular problems, movement problems and postural problems. The main three areas of the brain which is affected in cerebral palsy are The three areas of the brain that is affected are: one is cortex. Most commonly, cortex is get affected because cortex, especially when you talk about frontal cortex, so so many motor centers are present there. Okay, so when cortex is gets affected, motor activities are get affected because all the motor activity, that particular, to say, the plans are formed in the cortex itself, that will be executed by the muscles, but that particular plan is programming is done in the cortex itself. Another common area where the cerebral palsy effect is, that's a basal ganglia area. So basal ganglia is important for the initiation of the movements and also prevention of the excessive movement, unwanted movement prevention. That means modifying or tuning the movement. That is the function of the basal ganglia. And sometimes, unfortunately, basal ganglia will be affected, and that leads to also cerebral palsy. That's a different type of cerebral palsy. Sometimes cerebellum is get affected. Cerebellum is very important for the tone, posture, and coordination and equilibrium of the body. So when cerebellum is predominantly affected, and that particular cerebral palsy is called as atonic cerebral palsy. When basal ganglia is predominantly affected, that cerebral palsy is called as dyskinetic cerebral palsy. And when the cortex is affected with the involvement of all the motor activities, that cerebral palsy is called as spastic cerebral palsy. Now, what are the most common causes if you see? The most common causes if you see for the cerebral palsy, there will be some permanent damage to the brain. It's a non-progressive, that's a one-time damage. The one-time damage is happening because of which the brain is get damaged, and there is no further growth, and that leads to all the problem. There is no continuous damaging going on, only one-time damage. Okay, so what is actually the cause? The prenatal cause. The most common prenatal causes which may lead to cerebral palsy in the child is radiation, some of the infections like torch infections, or hypoxia during the time of the delivery, or placental insufficiency leading to the hypoxia, etc. And these are the prenatal causes. Now, if you see the perinatal causes, the most common perinatal cause is birth asphyxia, okay, or there may be fetal distress, or obstruction or obstructive deliveries, okay, instrumental deliveries, and some other head injuries during the time of the delivery. So these are the most common causes from the perinatal period. Postnatally also cerebral palsy can occur. The most common is head trauma after birth, if there is a head trauma, or some infection like septicemia, etc. Then most common is sometimes hydrocephalus, or most common is kernicterus. Okay, these are some of the postnatal causes. Kernicterus, okay, hyperbilirubinemia of a pathological type, so may go and bilirubin may stain the basal ganglia and leads to this problem. And one of the most common causes is asphyxia neonatal. That is asphyxia which is occurring at the time of the delivery. It may be because of meconium aspiration, or it may be some of the other causes, any causes during the labor or during the delivery. That is the most common cause. Okay, asphyxia. We will call it as hypoxic ischemic encephalopathy. So sometime cerebral palsy may be also because of gene mutations leading to abnormal brain development. That is also possible. Sometimes there is abnormal development. The problem is none of these, but there is some gene mutations taking place, and because of which this is happening. Maternal infections constitutes the major part again. Maternal infections like German measles, herpes simplex. So they're also the leading cause, where you cannot find any history of birth asphyxia, meconium aspiration, etc. But still the child is having cerebral palsy. Brain infections like encephalitis and meningitis, this is also the most common thing. Some of the intracranial hemorrhages are also the causes of cerebral palsy. Head injuries due to accident, fall, or child abuse, or sometimes instrumental deliveries, etc. is also the cause of cerebral palsy. Now, where you find the risk of cerebral palsy more? Risk of cerebral palsy is more in premature birth, okay, preterm deliveries, premature birth, low birth weight babies, twin babies or triplet babies, or any child with a low Apgar score at the time of the birth, that is asphyxia, or breech presentations, or if the mother is suffering from RH incompatibility, infections during the pregnancy like rubella, any type of trauma, okay. In 2% cases, it is of genetic cause, as I told, it can be caused because of mutations, and maternal exposure to toxic substances like methyl mercury, etc. So these people are having a risk of a cerebral palsy. Those who are having all these problems, they are having high risk of a cerebral palsy. Prematurity and cerebral palsy, they are interrelated because prematurity is considered as one of the most common risk factor for cerebral palsy, because prematurity most of the time leads to periventricular leukomalacia, one of the condition where periventricular, the white matter of the brain is get affected, okay, around the basal ganglia area, etc. So the peri means surrounding. Peri areas of the ventricles are get affected, which contains many important centers and also the tracts. That's white matter of the brain. Okay. So leuco in English it means whitish deposition, and malacia means gaps. So or malacia also refers to non-functional. So there is some non-functional white matter of the brain. Okay. Especially important ventricular area, the ventricles, lateral, middle, fourth ventricle. So surrounding that area which is present in the base of the brain, so that will be converted into a leuco or whitish matter. So that is a non-functional matter which contains some of the gaps. So white matter of the brain is responsible for transmission of the signals. All the tracks, okay, all the tracks coming upside and going up downside, all of them are considered as white matter because they are all made up of axons. Okay, so white matter of the brain responsible for transmission of the signals inside the brain and also to the rest of the body, and this is done by the tracts, different types of spinocerebellar tract, spinothalamic tract, etc. All the tracts, okay, pyramidal tracts, etc. So damage to periventricular area, okay. So when there is a damage in the CT scan and MRI, if you see, so that area, periventricular area, periventricular leukomalacia area, that looks like a tiny holes in the brain of the infant. So these gaps interfere with the normal transmission of the signals. Okay, in the white matter, in between the white matter, there is some hole. So white matter tracts which are carrying the signals, that cannot be properly now carried because there is a break in between because of these holes. So again, there will be a movement problem. Okay, so this is actually what is happening in case of prematurity. In prematurity, children or babies are have more risk for cerebral palsy, and the cause is this. Now, talking in terms of term infants, okay, term infants otherwise they are okay, but the problems related to placenta, even in the term infants, it may be dangerous. Okay, by a term infants with some of the birth defect, he may develop cerebral palsy. Low birth weight babies, again, we have high risk. Mucinum aspiration syndrome leading to systemic asphyxia. Systemic asphyxia is a systemic problem in newborn. Okay, multi-system problem. Okay, it causes involvement of many systems. Brain is also involved. Then LSCS babies are also having more risk than instrumentation, as I told, injuries, etc. may be the cause. Seizures after the birth. If the baby is having seizures after the birth due to any of the causes, that is also having high risk in a term baby. Respiratory distress syndrome. Respiratory distress syndrome will cause reduced oxygenation to the brain, and that leads to the problem. Okay, so it is still unclear that how much is the role of asphyxia in causing cerebral palsy. Of course, actually this is a matter of discussion. It is still unclear that how much is the role of asphyxia in causing CP. In 2015, most cases of the CP of the term and near term babies have causes other than asphyxia. That means when CP occurs in a term babies, okay, so most cases of the CP in 2015 data, it says that term and near term babies, when they have got a CP, so they didn't have any asphyxia, but still they developed cerebral palsy. So we cannot say that all the asphyxiated babies will develop the CP in future, or asphyxia is one of the major causes of CP. So it cannot be universally said, because we find this data set. 25 cases are genetic in nature, where glutamate decarboxylase enzyme 1 is involved. It's a type of autosomal recessive. Sometimes, that's what I'm telling. Sometimes cerebral palsy is also related to genetic factors. Okay, especially the glutamate decarboxylase enzyme 1 deficiency, which is autosomal recessive disorder, that may also cause cerebral palsy-like condition. Now, in the early childhood, if there is cerebral palsy, the most common cause, there is no perinatal history, there is no antenatal history, there is no birth history, but in the early childhood, there may be some time may lead to cerebral palsy. Okay, after birth, yes. So some of the toxins may cause cerebral palsy. Severe jaundice may cause cerebral palsy. Lead poisoning is one of the leading cause. Physical brain injury can cause cerebral palsy. A stroke, then abusive head trauma, then any other incident with the hypoxia to the brain. Any Other incident which cause hypoxia to the brain may cause encephalitis or meningitis. So these are some of the common causes in the early childhood period. If you look into epidemiology of cerebral palsy, 2.1 to 4 birth out of 1000 birth, we already told in the beginning. So they are having the risk of cerebral palsy. In the term baby, the risk is 1 for 1000 birth. Whereas in other low birth and preterm, it is almost all 2.1 to 4 in 1000 birth. Rate are similar in developed and developing countries. This is very important. The cerebral palsy incidence rates are similar in developed and developing countries. In developed countries, what happens? They have got advanced neonatal care, so they are able to save the baby, which is also which is having asphyxia because of the advanced neonatal care. But quality of the life later onwards is not worried by anybody. Okay, so such babies may develop into the cerebral palsy children in future, as the brain damage has been already taken place in the initial part. Again, in the poor people, it's quite common because of so many reasons, and it's also higher in males compared to female, higher in males. These are the incidences. Okay, moderate to significant rise in 1970s and 1990. So if you see the history in cerebral palsy, around 1970 and 1990, there is a significant rise in cases of cerebral palsy. Especially, this is later found that this is because of a rise in the low birth weight care during this time. That means there is a high advancement in the neonatal care during this time, and we are able to save the preterm babies, we are able to save the low birth weight babies or asphyxiated babies because of advancement in the neonatal care. Of course, that's what I told you. They're able to save the life of the baby, but the quality of the life later onwards is questionable. It's a low quality of the life, and that may lead to cerebral palsy. That's the reason why there is a rise in this particular period. There is increased survival rate in this of these infants. Okay, disability, right movement, and baby do law. Okay, so 2005 it's told that advanced mother care and baby care does not decrease the incidence of CP. Okay, 2005 it is declared that we have got advanced neonatal care and also we have got advanced maternal care, but in spite of that the incidence of CP are not decreasing because that's the same problem. Okay, when cerebral asphyxia is happening, initially there will be brain damage is already happened within first few minutes of the life, and later on by the advanced methods we are able to save the life of the baby. But that child in the future is developing into cerebral palsy. It is unpreventable. That's the big problem. Now, what are the common symptoms if you see? The group of permanent disorders of the development of the movement and posture causing the limitation with a non-progressive disturbance in the developing fetal and infant brain. This is the latest definition of a cerebral palsy. Group of permanent disorders of the development of movement and posture causing limitations in non-progressive disturbance in the developing fetal and infant brain. So movement problems are actually the central feature of CP. Movement problem, spasticity, okay, rigidity. These are the that's muscular involvement. That is the central feature of the CP. Difficulty in thinking will be also there. Difficulty in learning will be also there, or difficulty in feeling some of the sensations, that will be also there. And there is also communication problem is also there, and behavioral problem is also co-occur. That means whatever the main problem is always with the gross motor movement. Okay, involvement of the gross motor movement domain. Along with that, there is also some involvement of basal ganglia. That's difficulty in thinking, learning, and feeling, and also communication. That is also there. 28% of chances of epilepsy is there. 58% will have the difficulty in communication, and about 42% have got the problems with vision. Vision is one of the main problems because hypoglycemia, suppose asphyxia causes hypoglycemia. Hypoglycemia basically affects the retina first. So therefore, such babies will have difficulties in vision. Okay, so and 23 to 56% will have learning disabilities. These are the incidences of cerebral palsy. Now, talking about the muscle tone, the abnormal muscle tone and reflexes, and also there is coordination. This is a main feature of cerebral palsy, as the muscle involvement is more. The neurological lesion is primary and permanent, while orthopedic manifestations are secondary and progressive. Okay, the neurological lesions which are happen in case of cerebral palsy, it is always permanent, but because of that spasticity and all, we have got a lot of orthopedic manifestations. Orthopedic manifestations are secondary and progressive. They may go on progress. First, there is spasticity. Spasticity leads to contractures. Contractures lead to deformities. Deformities leads to so many other problems, fractures. So, orthopedic problems go on increasing. All the neurological problems are static. Okay, so in CP there is an unequal growth between the muscle tendon units and the bone. This is a basic problem. What happens? In CP there is unequal growth between the muscle tendon units and the bone. Okay, so eventually it leads to bone and joint deformities. Okay, bone is growing in its own phase, and now muscle tendons are not able to grow accordingly because they are under spasticity. Okay, so they are not able to cope up with that. They are not able to grow in accordance with the bone, and that leads to bending of the bones, deformities of the bone, contractures of the bone. So to start with, these deformities are dynamic. In the beginning these deformities are dynamic, but over the years it becomes static and joint contractures will going to develop. Okay, so now deformities in general and static deformities in specific. Okay, so deformities in general and static deformities in specific. Joint contractures that leads to the difficulties, toe walking. Okay, so and scissoring gait. So these are all the outcome of the deformities and spasticity or contractures. Okay, so there may be tip toe walk and scissoring gait, etc. will be there. Joint contractures will be there. Why this is happening? That is because of this muscle tone and bone problem. Okay, they are not able to cope up each other. Baby at birth may have irregular posture. At the time of the birth, baby is having irregular posture, and body may be stiff and as well as floppy. I'm sorry, there are some spelling mistakes. Okay, I'm sorry for that. So birth defects like spinal curvature, small bow zone, and microcephaly are sometimes occur along with the CP. Now symptoms may change as child get older. As the child get older, the symptoms may go into change. By 6 to 9 months, when they start to move, there is preferential use of the limbs and asymmetry of the gross motor developmental delay, etc. can take place. So drooling is very common because it has got the impacts like social rejection, impaired speaking, and damage to the cloth and books and mouth infections, etc. Also, there is a choking because of this drooling. Okay, so drooling suggests that child is not able to maintain the tone of the facial muscles, and because of this the drooling is taking place. Okay, so 55.5% patient will have the lower urinary tract infections, and more common in the storage is the storage issue rather than the voiding issue. Those with the voiding issue and the pelvic floor muscle overactivity leads to upper urinary tract disorders. There are some skeletal issues. Bones maintain a normal shape of the body and size. So low bone mineral density. Shafts are often thin and leading to the narrow joint spaces. So depending on severity of spasticity, they exhibit the variety of angular joint deformities because vertebral bones need vertical gravitational loading forces to develop properly, and spasticity hinders the same. Okay, so people of cerebral palsy become shorter than the normal as the bones are not allowed to grow to their own functional potential. So prone to low trauma fractures. They're also prone to low trauma fractures. Further, it affects the movements of the child, strength, and experience the pain. And also there is school missing and child abuse suspicions, etc. If you look into some of the skeletal issues, hip dislocation and ankle equinase or plantar flexion deformities are two most common deformities we find in case of cerebral palsy related to skeletal issues. Hip dislocation and ankle equinase, toe walking will be there. So flexion deformities of the hip and the knee can also occur at times. It is corrected by soft tissue procedures like adductor muscle release, etc. Usually it is done. Scoliosis before the age of 10 years is most likely to develop. That can be also corrected surgically before 10 years. Equinus deformities can be corrected by conservative methods. Now, child will also have some of the eating issues, sensory and motor impairments. There is difficulty in preparing, holding the utensils, and also chewing and swallowing. So child is not able to suck, swallow and chewing. And gastroesophageal reflux is also most common. Either there is too less or over sensitivity around the mouth. That's the problem. So occupational therapy will going to help to some extent here. Either too less or over sensitivity around the mouth will be there. So poor balance while sitting, no head control and no control over the trunk, etc. makes the eating very difficult for the child. So there is a lack of hand and eye coordination also. And pneumonia is quite common in cerebral palsy because of aspiration, because of the eating problem. So there is every chance of aspiration that may lead to the pneumonias. There is also risk of undernutrition. When child is not able to eat properly, there is also risk of undernutrition. So triceps thin fold is a reliable indicator for the malnutrition, as we know. Now there is also some speech problems. Newborn will with the cerebral palsy or child with cerebral palsy will also have the speech problems. Speech and language problems are very common here. Okay, 31 to 81% will have the dysarthria, and many are having non-verbal problems, non-verbal communication problems. Now, pain and the sleep. See, due to inherent conditions associated with the conditions, and due to different procedures, child may have very much painful limbs or muscular groups. Okay, so when they are in pain, they face worst muscle spasm. Okay, this spasm which is happening because of spasticity, it's not a simple spasticity. Okay, that causes the pain also. So child with a cerebral palsy faces a lot of pain. Pain with the tight and short muscle fibers, abnormal posture, stiff joints, unsuitable arthrosis, etc. are quite common. Okay, hip dislocation is also common. That may also lead to pain. So sleep disorders are common. Therefore, because of this pain, child is not able to sleep at night. Okay, so sleep disorders are common, which are secondary to both physical and environmental factors problems. So higher the rates of sleep disturbance will be there. So usually a child not able to appreciate, it means express all those things. But at night, a cerebral palsy child, because of these spasms, he will have a very worst pain. Now, some of the other associated problems that we will have is intellectual disabilities. Child may have the seizures, muscular contractions, abnormal gait, osteoporosis, communication problems, then again malnutrition, sleep disorders, mental health disorders, depression, anxiety. These are all associated with the cerebral palsy. Okay, there may be also functional GIT disturbances, vomiting, constipation, etc. So this is the important causative factors and outcome and comorbidities of cerebral palsy. So in the next class, we will discuss about the detailed explanation of these different types of cerebral palsy. For today, this much is sufficient. Thank you very much. Don't forget to subscribe my channel and also give your comment. We will meet in the next part of cerebral palsy. Thank you very much.